Is it in the patient's best interest to miss their appointment on Friday and then call you on Sunday for an emergency visit? See, that's a boundary issue.
Welcome to AMC. I'm Dr. Greg Miller. Have you set healthy boundaries with your patients? Today, Dr. Callie Seymour is going to give you 3 keys to establishing healthy patient boundaries. You won't want to miss her advice about assumptions. If you find this video to be helpful, please click the like and subscribe buttons. Let's get started.
Hello, colleagues and friends. I'm Dr. Callie Seymour, one of your AMC instructors. Today, we're going to help you discover 3 keys to establishing healthy patient boundaries. And this goes far beyond what you're going to learn in your annual ethics class for your CEs. This is about establishing the kind of lifelong relationship with your patients that not only gives them hope, but guides them in the direction that's going to get them the best possible results. Establishing healthy patient boundaries is critical for you to have a stress-free, referral-based practice. And it's critical for you to develop the kind of community in your practice that allows patients to stay, pay, and refer. So it's all about having that healthy practice with clarity. So the key number 1 to establishing healthy patient boundaries is always do what's best for the patient. Now, this seems obvious from a clinical standpoint. This is obvious. But what I mean goes even deeper than what you're going to execute clinically. Always doing what's best for the patient is a headspace issue. It's a mentality that you carry into every patient interaction. And if you've got in the back of your mind that I'm always going to do what's best for this patient, then you're going to be a lot less likely to let them, say, talk about the weather instead of their condition, right? You're going to be a lot less likely to kind of let them get away with things that you know are not in their best interests. And you literally have a responsibility to guide them in that manner. So, for instance, is it in the patient's best interest to miss their appointment on Friday and then call you on Sunday for an emergency visit? See, that's a boundary issue. Second example, is it in the patient's best interest to not be on an established care plan and to just kind of call you when they hurt? Is that in the patient's best interest? No, it's not. Is it in the patient's best interest to tell you that they will not be doing films that day or will not be doing their progress exam that you know that they need in order to establish where they are in the parameter of care? See, none of these things are in the patient's best interest, but it's things that happen all the time on a regular basis in offices. So this is more about establishing your mindset to where you could be in any situation with the patient, but what you do or what you don't do is going to be determined by that question. Is this in the best interest of the patient? So the second key to establishing healthy boundaries with your patients is don't assume. Don't ever assume. Don't assume that they do know what you're saying. Don't assume that they fully understood what you said because you said the word subluxation right off the bat. Don't assume that their question is a question of challenge when it might be a question of comprehension, okay? So you always give the benefit of the doubt, but don't ever assume that the patient fully gets the chiropractic principle. You always take the initiative and the responsibility to educate them, be consistent with them, tell them what's in their best interest, and help them by guiding them to what they need to do. Don't expect them to direct that. You direct that as the leader in your practice and as the doctor that they've chosen to entrust their healthcare to. Key number 3 to establishing healthy patient boundaries is remember that you are their doctor, not their friend. Now, can you be both? Sure, you can be both. But when they're in the office, you are their doctor first, even if you're their friend second, okay? And this even goes for your spouse and your children. As soon as they walk in that office, if you're adjusting them there instead of home, You are their doctor. And at that moment, not only do you give them that covering of authority that comes with being their doctor, but you also help them by having the clarity in your own boundaries. So this means you're not talking about friendshipy things in the office. You can schedule a lunch for that. But when they're in the office, you are solely focused on them, on the benefits of the healthcare that they're there for, and on the positive interaction that they came to only you to be able to get that day. So in summary, 3 keys to establishing healthy patient boundaries. Number 1, always do what's in the best interest of the patient. Number 2, don't assume. And number 3, you're their doctor, not their friend.
If this has been helpful, like and subscribe to be notified whenever new videos come out. As always, we're here to help. Text us any questions you have to 904-966-4996. AMC is your guide to becoming respected, effective, and valued in practice. See you next week.